I'm Dr. Michael Harrison, and today I need to talk to you about something that happens in your home every single day. Something so routine, so ordinary that you have never once thought of it as dangerous. Your shower. Now, before you think I have lost my mind, hear me out. In my 40 years of treating patients in the hospital, I have seen strokes triggered by things that would shock you, and some of the most preventable cases I have ever witnessed trace back to habits people practice every single morning or every single night in their own bathrooms. Every 40 seconds, someone in this country suffers a stroke. The American Stroke Association has been sounding the alarm for years, and yet most people still think strokes only happen to people who eat poorly or never exercise. The truth is far more complicated. Your blood pressure, your body temperature, the chemicals you breathe in, even the angle of your neck, all of these play a role, and your shower is the one place where all of these factors collide at once. Today, I am going to walk you through 5 shower habits that research has linked to increased stroke risk, especially for adults over 50. We are going to count down from number 5 to number 1, and I saved number 1 for last because it is the one that almost everyone does and almost nobody suspects. I think it is going to change the way you think about your evening routine forever. Before we dive in, I want to be clear about something. While I am a physician sharing evidence-based information, this video is for educational purposes only. It is not a substitute for personalized medical advice from your own doctor who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let us get into it. Now, let me start by telling you why this topic matters so much to me personally. About 6 years before I retired, I treated a woman I will call Dorothy. She was 68, sharp as a tack, volunteered at her local library 3 days a week, and walked 2 miles every morning. She had no family history of stroke. Her cholesterol was well managed. By every measure, she was doing everything right. Then one Tuesday morning, her daughter found her on the bathroom floor, unable to move her left side. She had suffered a stroke sometime during or just after her morning shower. When we investigated what happened, we discovered a combination of factors: the water temperature, how quickly she stood up, the lack of ventilation in her small bathroom. Any one of those alone might not have been enough, but together, they created a perfect storm. Dorothy recovered about 80% of her function after months of rehabilitation, but she told me something I have never forgotten. She said, "Dr. Harrison, if someone had told me my shower could do this, I would have changed everything." I promised her that day that I would start telling people, so here I am, keeping that promise. Let us begin with number 5 on our countdown. Standing up too quickly in the shower or bathtub. This one sounds so innocent that most people brush it off entirely. You have been sitting on a shower bench, or maybe you have been leaning down to wash your feet, and then you stand up. You feel a little lightheaded. Maybe your vision goes dark for a second, then it passes and you think nothing of it. But here is what is actually happening inside your body in that moment. When you stand up suddenly, gravity pulls blood downward toward your legs. Your body is supposed to compensate by tightening your blood vessels and increasing your heart rate to push blood back up to your brain. In younger people, this happens almost instantly, but as we get older, this system slows down. The blood vessels become stiffer and less responsive. And if you are taking blood pressure medication, which millions of adults over 50 are, that compensation can be even more delayed. This condition is called orthostatic hypotension, and it means your blood pressure drops suddenly when you change position. That moment of dizziness is not just an inconvenience, it is your brain being temporarily starved of oxygen-rich blood. Research published in Hypertension Research in 2022 found that seniors who experienced repeated episodes of orthostatic hypotension had a 53% increased risk of stroke within 3 years. And for those whose episodes happened specifically during or after bathing, the risk was even higher. But here is the part most people miss. It is not just the drop in blood pressure that is dangerous. Sometimes the body overcorrects. Your blood pressure plummets, and then your nervous system panics and sends it surging back up. That sudden spike can put tremendous strain on small, fragile blood vessels in the brain. And if one of those vessels gives way, you are looking at a hemorrhagic stroke, which is bleeding inside the brain. I want to tell you about someone I will call Frank. Frank was a 73-year-old retired postal worker, a big, sturdy man who had been on blood pressure medication for about 8 years. He used a small stool in his bathtub because his knees bothered him. Every morning he would sit, wash up, and then stand to rinse off. He told me he always felt a little woozy when he stood, but he just grabbed the shower curtain rod and waited for it to pass. One morning the dizziness did not pass. He lost consciousness for just a few seconds, fell sideways, and struck his head on the edge of the tub. When the paramedics arrived, they found that Frank had not only sustained a head laceration, but had also suffered a transient ischemic attack, what we commonly call a mini-stroke. A CT scan showed a small area of reduced blood flow near the base of his brain. We adjusted his medications, installed proper grab bars in his bathroom, and I taught him what I call the 10-second rule. Before you stand, take a deep breath. Grip something solid, not a towel rack, not a shower curtain, but a properly installed grab bar. Then rise slowly while counting to 10. Give your blood vessels time to do their job. Frank followed that advice religiously. 3 years later, no more episodes. That 10-second habit may very well have saved his life. Now here is where most people get it wrong. They think the solution is just being careful. But carefulness is not a strategy. You need a system, a grab bar, a routine, and an awareness that this is a real medical risk, not just a minor annoyance. This brings us to number 4. And pay close attention here, because this one involves something you cannot even see. Poor ventilation in your bathroom. Think about what happens when you take a hot shower with the door closed and no fan running. Steam builds up fast. The mirror fogs. The air gets thick and heavy. It feels warm and relaxing. But what is actually happening in that small enclosed space is genuinely alarming. When hot water runs in a closed bathroom, the humidity skyrockets, oxygen levels drop, carbon dioxide levels rise, and here is what makes it worse. The steam is not just water vapor. It carries with it volatile organic compounds released from your soap, your shampoo, the caulk around your tub, your shower curtain, even the paint on your walls. You are essentially standing in a warm chemical cloud and breathing it deep into your lungs. Researchers at Environmental Health Perspectives published findings showing that in poorly ventilated bathrooms, carbon dioxide levels can spike dramatically in less than 10 minutes of running hot water, while oxygen levels drop enough to create what scientists call a mildly hypoxic environment. That means your brain is getting less oxygen than it needs to function properly. Now, for a young, healthy person, this is a minor stress. The body compensates. But for someone over 50, especially someone with existing cardiovascular concerns, this repeated oxygen deprivation adds up. It contributes to inflammation in the blood vessels, raises blood pressure over time, and increases the long-term risk of both stroke and cognitive decline. I had a patient, a lovely woman I will call Gloria, who was 72 and lived in a small apartment. Her bathroom had no window and no exhaust fan, and she always kept the door closed for privacy. She took long hot showers every evening. Over several months, she started noticing that she felt confused and dizzy after her showers. She thought it was just fatigue. One evening, she stepped out of the bathroom and collapsed. At the emergency room, we determined she had experienced a transient ischemic attack. Her oxygen saturation when she arrived was below where it should have been. When we traced her daily routine, the poorly ventilated bathroom stood out as a significant contributing factor. We helped her install a small exhaust fan and taught her to crack the door open at least an inch while showering. Within weeks, her dizziness episodes stopped completely. She even told me her thinking felt clearer and she was sleeping better. That is the power of something as simple as air circulation. I want to pause here and remind you of something important. I am not suggesting you change any medications or treatments without speaking to your prescribing physician. What I am sharing today may inform a conversation with your doctor, but any changes should only be made under their guidance. If you know someone who struggles with any of these issues, a spouse, a parent, a friend, please share this video with them. You might be giving them information their doctor never had enough time to explain. Alright, stay with me here because we are about to get to the really practical stuff. Let me make sure you caught everything so far. Number 5 was standing up too quickly, which causes dangerous blood pressure drops. Number 4 was poor ventilation, which quietly starves your brain of oxygen. Both are serious, both are fixable, and both are things that almost nobody thinks about. Now let us move to number 3, which builds directly on what we just covered. Taking extremely hot showers. I understand the appeal completely. A hot shower feels wonderful. It loosens stiff muscles, eases joint pain, and on a cold morning, there is nothing quite like it. But here is what the research actually shows about what that hot water does to your cardiovascular system. When very hot water hits your skin, your blood vessels rapidly dilate. They expand wide to move blood closer to the surface, which is your body's way of releasing heat. This causes a temporary drop in blood pressure, but then your body detects that drop and activates what we call the sympathetic nervous system, your fight-or-flight response. Your heart starts pumping harder, your blood pressure surges back up, and your arteries, which just expanded, now have to handle a sudden rush of high-pressure blood flow. For someone with healthy elastic blood vessels, this back and forth is manageable. But for older adults, especially those with atherosclerosis, which is the hardening and narrowing of the arteries, this rapid fluctuation can be genuinely dangerous. The small vessels in the brain are particularly vulnerable. They can tear under pressure, leading to a hemorrhagic stroke, or the turbulent blood flow can dislodge a small clot, leading to an ischemic stroke. A study published in the Journal of Stroke and Cerebrovascular Diseases in 2020 found that people who regularly took very hot showers had a 44% higher risk of stroke, and the risk increased significantly when those showers lasted longer than 15 minutes. The researchers specifically noted that the combination of extreme heat and poor ventilation created what they described as compounding cardiovascular stress. And here is the part that stopped me in my tracks when I first read this research. The danger does not end when you turn off the water. When you step from a steaming hot shower into a cooler bathroom, your blood vessels suddenly constrict. That transition creates yet another surge in blood pressure. It is like a seesaw, up and down, and every swing puts strain on the most delicate blood vessels in your body. The solution is simpler than you might think. Keep your shower water warm, not hot. If your skin turns red during or after your shower, the water is too hot. A good test is this. The water should feel comfortable on the inside of your wrist, which is one of the most temperature-sensitive areas on your body, and try to keep your showers to around 10 minutes. You still get clean, you still feel refreshed, but you are not putting your cardiovascular system through unnecessary stress. I had a patient I will call Harold, a 69-year-old gentleman who loved his scalding hot showers. He told me the hotter the better, that it helped his arthritis. One winter morning he stepped out of his extremely hot shower into his cold bathroom and immediately felt a crushing pressure in his head. His wife found him gripping the sink, unable to form words. The emergency scan showed a small hemorrhagic event in his right hemisphere. We worked with Harold on finding the right temperature, warm enough to be soothing, cool enough to be safe. He was surprised at how quickly he adjusted and told me he actually felt more energized with the lower temperature because his body was not working so hard to compensate. Now here is something that might surprise you. This next habit, number 2, is something that most people think is completely harmless, and some people even think it is healthy, but for adults over 50, it can be one of the most dangerous things you do in the shower. Number 2, tilting your head backward under the shower stream, especially under high-pressure shower heads. Picture this. You are standing under the water, and you tilt your head back to rinse the shampoo from your hair. The water hits your face and scalp, and the pressure feels invigorating. You have done this your entire life. It seems like the most natural thing in the world, but for older adults, this movement can compromise blood flow to the brain in a way that is both immediate and serious. When you tilt your head sharply backward, you compress the vertebral arteries. These are the arteries that run along the sides of your neck and supply blood to the brainstem and cerebellum, the parts of your brain that control balance, coordination, and vital functions. In younger people, these arteries have enough flexibility and clearance that a brief backward tilt causes no problem. But with age, these arteries can narrow due to plaque buildup or degenerative changes in the cervical spine. A sharp backward tilt can briefly pinch or compress these already narrowed vessels, significantly reducing blood flow to critical areas of the brain. This condition is known as vertebrobasilar insufficiency, and it can cause dizziness, blurred vision, difficulty speaking, or even loss of consciousness. In a study published in Stroke and Vascular Neurology in 2019, researchers found that head and neck positioning was a contributing factor in transient ischemic attacks in 14% of stroke patients over the age of 65. The most frequently reported scenarios included tilting the head backward in the shower, at the hair salon, and while looking up at high shelves. I want to tell you about someone I will call Richard. Richard was a 76-year-old retired engineer, a meticulous man who approached everything in life with precision. He came to the hospital after suddenly losing his balance and slurring his words one morning. Imaging confirmed an ischemic stroke near the base of his cerebellum. When we reviewed his daily habits, one thing stood out. Every morning he tilted his head all the way back under a high-pressure shower head to rinse his hair. He told me he liked to feel the full force of the water right on top of his scalp. He said it woke him up. Further testing revealed he had significant narrowing in his vertebral arteries, a condition he never knew about because it had never caused symptoms until it did. After his recovery, we taught him a simple change. Instead of tilting his head backward, he now tilts it slightly forward and lets the water rinse from the crown of his head downward. No more neck hyperextension, no more compression of those critical arteries. It felt awkward for about a week, then it became second nature, and he has not had another episode since. So if you are used to looking up into the water, I am asking you to make this one change. Keep your chin level or slightly tucked. Rinse from the back of your head downward. It is a small adjustment that protects some of the most important blood vessels you have. Okay, we have covered a lot of ground. Let me bring this all together for you before we get to number 1, because this final point is where the rubber meets the road. So far we have talked about standing too quickly, poor ventilation, water that is too hot, and tilting your head backward. Every single one of these habits has a simple fix, and every single one of these fixes takes less than 10 seconds to implement. That is what I love about this kind of preventive medicine. We are not talking about expensive treatments or complicated procedures. We are talking about small, deliberate changes that protect your brain. And now we have reached the most important one. Number 1. The habit that almost every senior does, that feels perfectly natural, and that recent research suggests may carry the highest stroke risk of all: showering late at night right before bed, without giving your body time to cool down. I understand why this habit is so common. A warm shower before bed feels like a ritual. It is soothing. It helps you feel clean and comfortable. Many people tell me they cannot fall asleep without it, and I am not here to tell you to give up your evening shower entirely, but I am here to tell you that the timing and what you do afterward matter enormously. Here is the science. When you take a warm shower, your core body temperature rises, your blood vessels dilate to release heat, and your blood pressure temporarily drops. This is your body's natural thermoregulation at work. Now, if you give your body time to cool down gradually, this process actually helps promote sleep. Your body temperature naturally decreases as you approach sleep, and a gentle cool down after a warm shower can support that cycle. But here is where the danger lies. If you step out of a warm shower and go directly to bed, especially if your bedroom is cool or air-conditioned, your body has to make a rapid adjustment. Your blood vessels, which just dilated from the warm water, suddenly constrict to conserve heat in the cooler environment. This creates a rebound spike in blood pressure. For older adults whose arteries are already less elastic, this sudden constriction can be severe, and the timing makes it especially dangerous. During the first stages of deep sleep, blood pressure naturally drops. This is called nocturnal dipping, and it is a healthy protective process. But when you go to bed with your blood vessels already in a state of tension from that rapid temperature change, the normal nighttime blood pressure drop can become erratic and uneven. Some vessels constrict while others struggle to relax. The result is turbulent blood flow in the brain during the very hours when you are unconscious and unable to recognize warning signs. This is the reason many strokes happen during sleep or are discovered first thing in the morning. The person went to bed feeling fine and woke up unable to move one side of their body, or worse, did not wake up at all. A 2022 study published in the American Journal of Geriatric Cardiology tracked over 1,600 seniors for 2 years. The findings were striking. Those who regularly showered within 30 minutes of going to bed were 42% more likely to suffer a nocturnal stroke compared to those who showered earlier in the evening. And for individuals who slept in air-conditioned rooms immediately after bathing, the risk climbed as high as 68%. The researchers concluded that the combination of rapid temperature transition and impaired nocturnal blood pressure regulation created what they called a significant and modifiable stroke risk factor. This reminds me of one of the most meaningful conversations I have ever had with a patient. I will call him Walter. Walter was a 71-year-old widower who lived alone and had a bedtime routine that never varied. Every night at 9:30 he took a warm shower. By 9:45 he was in bed with the air conditioning set to 68 degrees. He said it helped him sleep. One morning Walter did not answer his phone when his daughter called at 8 o'clock, which was unusual because he was always an early riser. She drove to his house and found him in bed, conscious but unable to speak clearly or move his right arm. He had suffered a stroke during the night. After his recovery, which took several months of dedicated rehabilitation, we had a long conversation about his routine. We did not take away his evening shower. Instead, we changed the timing. He now showers at 8 o'clock, a full 90 minutes before bed. After his shower, he sits in his living room in light, breathable clothing and reads or watches television while his body temperature gradually returns to normal. His bedroom temperature stays at 72 degrees instead of 68. These are not dramatic changes, but his nighttime blood pressure readings stabilized significantly, and his doctor told him his vascular risk profile improved measurably. Walter said something to me during one of our follow-up visits that perfectly captures why I make these videos. He said, "Dr. Harisson, Nobody ever told me that something as simple as when I take my shower could matter this much. I just wish I had known sooner. That is exactly why I am telling you now. So here is what I want you to take away from today. Let me give you 3 clear action steps. Step 1. Start with your shower timing and temperature. If you shower at night, finish at least 1 hour before bed. Keep your water warm, not hot. Test it on the inside of your wrist. If it is comfortable there, it is safe for your whole body. Step 2. Address your bathroom environment. Make sure you have proper ventilation, whether that is an exhaust fan, a cracked door, or an open window. Install grab bars if you do not already have them. These are not signs of weakness, they are tools of intelligence, and switch to fragrance-free, naturally formulated products when you can. Step 3. Change your movement patterns. Rise slowly using the 10-second rule. Keep your chin level or slightly forward when rinsing your hair. And if you enjoy cooler water, ease into it gradually rather than shocking your system with a sudden blast of cold. These are not big sacrifices. They are small, deliberate adjustments that protect the most important organ in your body. Every one of these changes takes seconds to implement, costs almost nothing, and according to the research, can meaningfully reduce your stroke risk. Now I want to pause and say something from the heart. The most common obstacles I see when I share this kind of advice are not physical, they are psychological. People tell me, I have been showering the same way for 50 years and nothing has happened, and I understand that reasoning. But here is what I have learned in 4 decades of medicine. Prevention does not feel urgent until the thing you were supposed to prevent actually happens. And with strokes, by the time you feel urgency, you have already lost precious time and precious brain function. The whole point of what I do here is to help you act before that moment ever comes. Before I let you go, I want to share one more story that I hope will stay with you. I will call her Margaret. Margaret was 64 when she first started watching health videos online. She was not sick. She did not have any major diagnoses. She just wanted to take good care of herself so she could keep up with her grandchildren. She watched a video similar to this one and made 3 changes. She installed grab bars. She started leaving her bathroom door cracked open during showers, and she moved her evening shower from 9:30 to 8 o'clock. 2 years later, Margaret came to see me for an unrelated issue, and she mentioned those changes. She told me that her chronic morning headaches had disappeared, her blood pressure readings at her annual physical had improved, and she said something that made my whole day. She said, I do not know if I prevented anything, but I sleep better knowing I am not taking unnecessary risks. That right there is what this is all about. It is not about living in fear. It is about making informed choices that let you live your life fully and independently. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you have learned today and have a conversation with your doctor about what is right for you. If your doctor has concerns about your blood pressure, your medications, or your vascular health, they can personalize these recommendations specifically for your situation. If you found this helpful, if you learned something today that you can use, I would really appreciate it if you hit that subscribe button. I release new videos every week specifically designed to help you take control of your health and maintain your independence as you get older. And I promise to always give you the science without the hype. Drop a comment below and tell me which of these 5 habits surprised you the most. Have you been doing any of them without realizing the risk? I personally read every comment, and I would love to hear from you. Next week I am going to be covering the warning signs your body gives you days before a stroke, the ones that most people mistake for normal aging. You will not want to miss that one. Take care of yourself. I am rooting for you.